Hello PIA members, this is Mike Becker. I'm your Director of Federal Affairs here at the PIA National Office. I wanted to give you a quick update on Capitol Hill, namely in regards to healthcare reform. As I sit here, the United States Senate is grappling with two different healthcare reform proposals. In fact, Senate leaders are working on combining those two proposals into one single comprehensive bill. That bill will ultimately be brought to the floor of the Senate for a full vote, likely in the next couple of weeks. Now, across the Hill, the House of Representatives, they're a little bit further along in the process. They just released a 1,990-page bill. It's not a short bill. It's not a quick read. It's not a cheap bill either. It's estimated to cost between about $890 billion, about $1.2 trillion. Let's talk about some of the provisions. It does create a public option. It does create a health exchange. The good news about that is that professional independent insurance agents are allowed to participate in that exchange. That's great news because a lot of the prior drafts in both the House and the Senate specifically excluded agents from being allowed to participate. So we're happy about that. It's certainly a step in the right direction. There is some concern over the way that that provision was drafted, some of the technicalities related to it. However, it certainly is a step in the right direction. Now, further down in the bill, a lot more reason to be concerned. They are repealing the current antitrust exemption. The congressional leaders are stating that they need to do this because of market allocation, price fixing, monopolization in the industry that is taking place. The issue is that's already illegal. It's always been illegal under the McCarran-Ferguson Act. It's illegal under state law. So PIA here, we're dealing with that accordingly. Now this bill, this 1,990-page bill, is likely to be implemented over the next couple of years and should be in place by about 2013. However, a number of provisions will be enforced immediately. Let's talk about a couple of them. They're going to begin to close the Medicare Part D donut hole. They'll reduce the donut hole by $500, and they're going to institute a 50% discount on name brand drugs, and that's going to be effective January 1st of 2010. Immediate help for the uninsured. Effective immediately, an interim high-risk pool will be created. This high-risk pool will be made available to those who have not been able to get insurance or have been uninsured over the past few months, perhaps denied coverage due to a pre-existing condition. They'll be eligible to enter this interim high-risk pool, and this pool should last a couple years, at least until the exchange is created. Ban lifetime limits on coverage. It's going to prohibit health insurers from placing any sort of lifetime caps on policyholders. Extend coverage to young people. Individuals will be able to stay on their parents' insurance up until their 27th birthday. That too will be effective immediately. Immediate sunshine on price gouging. Any price gouging that may exist in the industry, they're hoping to end that by implementing a full rate disclosure on any rate increases. Creates new voluntary public long-term care insurance. This is going to be financed by voluntary payroll deductions, and it's going to provide benefits to adults who have become functionally disabled. There's going to be help for early retirees. It's going to create a $10 billion fund to finance a temporary reinsurance program that's going to be used to help offset the cost of expensive health claims, and that's going to be made available for retirees aged 55 to 64. These are just a few of the provisions that will be implemented immediately. There's certainly a lot going on. This bill, even though it's at 1,990 pages, it's likely to be tweaked slightly more. It's possible to vote on it as early as this week, and once they do so, assuming it passes the House of Representatives, they'll ultimately have to combine it with whatever comes out of the United States Senate. So there's still a lot of work ahead. They're working quite diligently, and they're moving forward, inching closer to the finish line, and we are certainly remaining engaged with congressional leaders on this bill. Please stay in touch. Visit our website, www.pianet.com, for some of the most up-to-date information. Thanks a lot.